Hello, everyone. Welcome to today's PermanenteDocs Chat. I'm your host, Alex McDonald. As many of you know by now, I practice family and sports medicine here in Fontana, California, as part of the Southern California Permanente Medical Group here at KP. So today's podcast, our topic, chat. We are very excited. I'm here with Dr. Charu Soni, who is a pediatrician from South Bay and the Director of Physician Leadership and Culture at Physician Leadership Development and Culture. There we go, at South Bay Medical Center. So welcome, Dr. Soni.
Thank you so much for having me. It's a great pleasure to share my story and to be here with you all today.
Wonderful. Well, we are looking forward to it. Today we're talking about patient engagement, and that can mean lots of things to lots of people. But we're going to start kind of with your story and your perspective, and then open it up. If you're listening or watching this live, you have questions, please drop them in the Q&A. We'll try to get to as many as we can. We only have about 20 minutes. We try to keep these short and high yield, so get those questions in early. I'll try to remind you halfway through as well. So, Dr. Soni, let's just kind of take a step back and tell us who you are and what you do.
Absolutely. So I'm a pediatrician, like you mentioned, at the South Bay Medical Center here in Southern California for SCPMG at KP. I have been here at KP since 2011. I went straight from residency. I'm a USC for life. I'm a Trojan for life. Went there for undergrad, med school, and residency, and then started straight here at KP and have been enjoying my tenure as a pediatrician, but also having that opportunity for my director role as the leadership development and culture. What does that really mean, though? What does that fancy title mean? That means I'm actually a champion for physician wellness. Mm-hmm. I do teach leadership development classes to our new leaders. I work on collegiality. So it's kind of like, hey, this department could work on their communication with each other. Mm-hmm. Let's talk together. And then I also run our Pathway to Partnership program, which is a program that we help navigate new doctors at KP. So I'm a really privileged to be part of that.
Great. Well, thank you for joining us. And again, we're talking about patient engagement today. And yes. So I want you to share a little bit about what patient engagement means to you, why it's important, and then also how you have kind of a unique way that you engage patients. Absolutely.
So honestly, for me, patient engagement is connection. Mm-hmm. It's what you have, that relationship with people, right? I think when you have that connection, it's not only important patient engagement, but connection for physician engagement as well. Because that's a huge piece, right? It's both physicians and patients. We're a partnership together. When you have that connection and relationship, you build trust amongst each other, and then you get professional happiness for being at work. Yep. At the end of the day, I really think we're all humans, and what we crave is human connection. But how does that translate to patients? It's patient outcomes. When you have that trust, people are going to make decisions with you rather than you telling and preaching as a doctor. Yep. You get to have a relationship and you make decisions together. What's best for you, and it includes and engages all aspects of what we're trying to do as human beings, like EID work, wellness work. All of this work converges if you're able to make that connection.
Yeah, I mean, as a family medicine physician myself, that's what I love best is building those relationships over time and getting to know. I take care of kids as well as parents as well as grandparents, often in the same family, multi-generations, and getting to know that whole family and having them get to know me as their physician, but also as a person, I think is just so much more valuable. And then it's just much more fun, right? Rather than, yes. Kind of feeling you're kind of going through a slog day in, day out. So I completely agree with you there. And then you can really, by having that trust in that relationship, there's clear data that patient outcomes are better. They're healthier. They utilize the ER less often. They utilize unnecessary or low value tests more often. There's so much data around how you connect with a person. And again, you and I both doing primary care is important, but even in a situation like the emergency room or an acute care setting where you have to make very quick decisions, how physicians present themselves, how they introduce themselves, all of that builds engagement and trust or lack thereof very, very quickly. And so I think it's not just in the primary care setting that we think about this patient engagement work.
Absolutely. And and that people think, oh, I have to have this longitudinal relationship with somebody in order to gain their trust. And you're so right on that you can make that small connection, even if you're quick in and out. If I'm seeing a new patient in urgent care that I've never met before. And it can be the smallest things. You just got to look around a little bit. Like if you're looking at a teenager and you see their phone, so many of them like drawings that they've made in their phone case or a picture or a family member, and you just have to ask, hey, tell me more about that. Or even small things like, hey, I love your glittery shoes, where did you get those? And I love what you talked about bringing yourself into the conversation. I know that we're in a privileged spot in that in primary care, sometimes you can bring more about yourself forward, maybe not so much in psychiatry and other specialties, but you're able to do that, even making that connection. Like I have two daughters, Gia and Nina, they're 5 and 9. And I actually just got my older one, the HPV vaccine. And I use it all the time. I use my kids all the time in the exam room saying, hey, I just got my daughter the HPV vaccine. I think it's so important. And, bringing yourself into the exam room and your experiences are so valuable. I don't know if you've ever had that experience as a kid when you would see your teacher outside of school. Right. And we'd be like, wait, what? Wait, you don't live at the school and you have other identities besides just being a teacher. I feel like that as a doctor too. Like sometimes if they see, I was once recognized at Costco by my laugh. They're like, Dr. Soni, but it's one of those things though, is that you are bringing yourself there and showing that you are a multidimensional human, you are more than just a physician. And that helps with that connection piece as well.
Yeah, I remember very clearly as a resident, actually, that moment where I was like, oh, I don't have to be this sort of like Norman Rockwell perfect image of a physician or what society says is a physician. I can just be Alex, who's kind of a goofball, and I can still engage with my patients. And it made medicine so much more fun, and felt like I could just be myself, and I didn't have to sort of be hiding behind sort of a mask, so to speak. So that was my own personal experience. So, well, tell me, you kind of already went into this a little bit. What are some ways that you and your colleagues engage your patients, not just inside, but also outside the exam room?
Absolutely. So I think that you need to start in the exam room so that it happens outside. And so one of the things I do is like in Health Connect, like our electronic medical record, there's actually a thing called a sticky note. And so I always write something in there, a fun fact about my patient, like, hey, they have a new dog. And so the next time I see them, hey, how's your new dog? And they're like, man, you have such a good memory. I'm like, but I also engage them and say, hey, I thought that was an important thing to remember. So I put it in your note, in your chart. And I show them the computer and how I want to connect with them. Or if I know that there was a big milestone, or even something like grades, like, hey, we talked about like maybe bringing up your grades and you were getting a tutor. How's your grade? And so when you do that, the biggest thing is for them to remember you outside of the exam room. And so that's how you start getting that engagement outside. I remember growing up, I never thought of my pediatrician until something was wrong with me. I was like, oh, I need to go see the doctor. But when you're able to engage them outside or inside your exam room, they start thinking about you outside. So actually I have a recent example. One of my patients was really excited about their Halloween costume. And so I said, hey, when you and your brother are in full regalia in your costume, send me a picture on kp.org. I want to see your picture. And sure enough, they sent me a picture and it was the best. And it was so fun because I created that connection with them about their excitement. And then they were able to engage with me again outside of the exam room through a kp.org message, which was really cool. And it's a great kp.org message to receive as a physician, to actually put a positive spin on, I know the big work burden we have on messages, but to have that little sparkle of embedded in your in basket can sometimes like just totally change your mood.
Yeah, when 90% of my messages from patients are usually I need help or I'm feeling bad, but every once in a while you get something being like, hey, thank you so much, or hey, look, I lost 25 pounds in the last 6 months, and like those little moments, like please, we want to hear those positive stories too, because as you said, people think of us and send us messages usually when there's something wrong. But
Yeah,
sending something positive can be very valuable. I completely agree with that.
absolutely. Absolutely.
So remember to drop your questions in the Q&A if you have questions. We definitely want to get to them. Talking about patient and care. If you have patient engagement. If you have a story, definitely let us know or ask those questions so we can get those in. What are some factors that you look for when you're thinking about patient engagement outside the exam room? Is there something specific that you do or your colleagues do or your clinic does to continue to kind of reach out to patients beyond the exam room?
There's a few things that I've seen actually my colleagues do, especially when I'm covering somebody's in basket, is
Mhm.
that they'll send a little reminder to themselves, maybe, 3 months or 6 months out to say, call this patient back to ask about X, Y, or Z. So I think it can be bi-directional, right? It's like you asking them to engage and tell us, hey, show me your Halloween picture, or tell me how's it going with your weight loss? Because I know you were really excited about that new program. But then it can be coming from us too. Be like, hey, we talked about this new medication. Tell me how's it going?
Mhm.
Us engaging with them and also, bringing. Sometimes they need a little nudge or a little reminder as humans, and we can be that person who provides it. But I love that I see those kinds of things in my colleagues in baskets as well as things that I do.
Yeah, absolutely. So there's a great question in the chat here, actually. So seeing so many patients in clinic now, any tips on how to conduct sort of efficient engagement where you can make that connection but still not run behind schedule in clinic, which we all suffer from.
Oh man, that's a phenomenal question that I have like a 30-point answer to. For sure, I think it's a quick thing is just as soon as you get in there, when I walk in the door, I say hello and I shake people's hands. I started doing it again during COVID. We kind of stayed
Yeah.
away from the physical contact, but
Mhm.
it was something that I say hello and shake everybody's hand in the exam room to say, hey, I see you that you're here,
Mhm.
grandma, mom, auntie. And then also high five the patient, you got to acknowledge that they're there too. So that's
Right.
a quick connection point, you don't even have to say anything, but just that acknowledgement. And then also just being able, I have to thank Mrs. Miller, my eighth grade typing teacher, but I'm able to type without looking at the keyboard. And I
Oh.
ask questions and make eye contact, I think Health Connect, going to Health Connect Essentials, improving your efficiency as a
Mhm.
physician
Mhm.
is a huge deal. So if you are able to go to that, I improve your skills so that after each patient, I finish my note before I go into the next one.
Yep.
And so, there's so many factors to that. I totally understand that it can be overwhelming when you're seeing that whole ton of patients, but these small little things help, but also it makes you want to go to work and it
Mhm.
brings fulfillment. Those are
Mhm.
the things that I think are so important. Like going back to the beginning of our conversation, is that, we can go through the grind of going through all those patients, but if you can make that interaction meaningful for
Yep.
yourself too,
Yep.
that's the secret sauce of a career of being able to retire at KP rather than, or any facility you work at, any I guess profession to be honest, is making that meaningful connection at work for yourself, whether it be whatever it is that your interest is, but bringing that meaning is what creates sustainability for all of us.
Yep. One quick way that I engage patients, particularly if I'm working urgent care or I'm seeing a patient for one of my colleagues, is I say, "Oh, I see you see Dr. Mahmood as your primary care doctor. I'm sorry you're stuck with me today, but how can I help you?" Right? And it's just kind of like a little bit of a funny joke, and it just sort of breaks that ice. And
Yes.
you can visibly see patients sort of relax a little bit when I take time to see, okay, you normally see this doctor. I understand you have a relationship with them, but I'm here. What can I do? Right? And I think that it works well for me, and it just takes a moment, honestly, to do that. So little pieces like that is something that I found helpful for me personally.
Absolutely. I totally agree with that, bringing each other up too. Of, sometimes I'll see patients who are from another medical center, but I went to residency with them. Like, oh, you have Dr. Singh? I went to residency with her. She's awesome. And like bring other people up, and
Mhm.
people will bring that to you, back
Mhm.
to you, like, oh, I saw, Dr. Soni, and she said she loves you. She says hello. That's another way to engage
Yep.
people, is like bringing them back and like sending messages through your patients, you know?
Yep, that makes perfect sense. So we have another question here.
Okay.
So do patients know that they can communicate through kp.org and use messaging on that level? Do you feel like that's something that's pretty commonplace? Obviously, I know teenagers have sort of the black hole where they're limited in terms of how they can communicate through kp.org. But particularly for parents of younger children, and then for myself, for my adults, I'm always reminding people, hey, you can use kp.org to reach out to me. Appointments are hard to find, but
Yeah.
email me and I'll try and do what I can through email. It's something that I do. Is there something specific you do to help kind of make sure patients know they can engage us on different levels?
Absolutely. I actually have the ability to sign people up myself. And I think it's a big priority for me, for my patients to be able to engage on kp.org. So I'll be like, hey, are you signed, mom or dad, are you signed up for kp.org? You know, if they're not, unfortunately, it's harder for me to sign up the child, but if they are, then I can sign up the child and link their profiles and be like, okay, you text me a picture, or you send me a picture, not text me a picture, but send me a message with a picture. You know, and these are, I think these are things that, yes, it does take an extra 2 minutes, but it saves me so much time, and the parent so much time if they're able to send me a message rather than trying to send them a telephone message through the call center, and it just decreases that barrier and access to care. And so, and we also do it in our newborn nursery. One of the tasks at South Bay for the clerk is to sign up all of our patients for kp.org as soon as they're born.
Yep. Yeah, that's wonderful. Yeah, when I have a newborn visit for their 2 or 4 week newborn visit, I always tell mom or dad, whoever's with them, like, hey, have you signed them up through kp.org? So you can email me through their chart. I have a lot of families I take care of. So often the mom will email me through the mom's chart about the baby. I'm like, no, you have to email me about the baby through the baby's chart. And so a little bit of education goes a long way. So here's a really interesting question in the chat. Do you agree that patient engagement and building trust is essential for timely and accurate diagnoses?
Oh, 1000%. I mean, that's a phenomenal question. It's, you know, it's about also kind of reading the room too, right? If like I'm trying to convince a parent, like, your child at this age doesn't have sinuses, so they can't have a sinus infection. I think it's just another viral infection. And if you're able to read that room and say, they are not buying what I'm trying to sell them.
Right.
And you take that one step, you're like, what are you worried about? What's concerning you? You know, and if you can, and then they'll reveal so much to you that, like, hey, my sister died of leukemia, and this was the first sign that they had. And if you're able to get that piece of information, I've just probably saved 3 more visits because they weren't able to say that. And that's the huge part of making that connection, and just reading the room and saying, is what I'm saying landing?
Yeah, I had a very similar experience. I had a patient who had they had seen several other doctors, multiple visits for headaches. And then I kind of sat down and I'm like, look, you've been seen 4 times in the last month for these headaches. Like, what's going on? Why are you worried? Turns out his father had died from a brain tumor. Right. And once you have that piece of information, the whole conversation changes. And I think a lot of times patients are kind of afraid to share that kind of that more personal information. And as physicians, we're kind of, we're busy. We're trying to get through our days. We have our checklist of X, Y, and Z we have to get through. And we sort of sometimes forget that there's a person attached to that checklist. And again, that's where that connection just becomes so helpful, because I see you as a person, you see me as a person. I feel like we're a broken record. We keep talking over and over here. So anyway, we're sending the take home message home multiple times in this visit.
Absolutely. I think we're cut from the same cloth, so this helps.
So there was a question here about engaging patients who struggle with mental health, who have depression, anxiety. Those can be sometimes harder patients to connect with. Do you have any specific strategies or alternatives when it comes to patients who are maybe harder to kind of open up, or whose mental health issues are kind of severely impacting their care or their presentation?
Absolutely. I think there's a little bit of a longitudinal approach. You kind of have to, it's again, building that trust. I think sometimes it does take a little bit longer with those patients, and you might not be able to do it in urgent care. when you're meeting for the first time, but maybe having that relationship over time as a primary care physician can absolutely help. If I can share just a personal story, is that I also, through COVID, developed a lot of anxiety, and I started going to see a therapist,
Mm-hmm.
and it was so helpful. And being able to share that part of myself, saying, this is what happened to me. I went to go see a therapist, and it was so helpful for me. And maybe you might want to consider doing that too. And I'm able to, of course, once I've built that trust, I have that relationship, saying, maybe you want to think about it too. And I'm just leaving it here as an option, and I'm giving you here the phone number. You can make that move if you want to. Know that it really helped me, and it really helped my family, and how I show up as a doctor and as a mom, as a wife, and sometimes giving them that permission.
Yeah, that's such a great example. Is just sometimes patients aren't ready to take that step, but if you can at least give them the options and give them the tools so that they're, when they're ready, they can then make that phone call or make that appointment or whatever that might be. That's really really helpful tip. Where can physicians learn more about how they can engage patients in a way or a style that fits kind of their practice, their practice setting, their style? Are there any kind of tools or resources out there where physicians can learn how to better engage patients?
So for me, my philosophy is that you got to look at yourself inward first. Where are your, if you could take half a day, see what's important to you. What are your values? What is fulfilling for you? And if you can really get laser focused on what that is for you, you can totally apply it everywhere, including work. And if it's like, I really love running. And so if I can figure out, hey, I really love your running shoes. Where'd you get those from? I like to run marathons. Or, you got to figure out what's your value and what's engaging and interesting to you. And then that's how you engage. I think a lot of it is looking at oneself, putting up the mirror and figuring out what's important to you. And that's the way you're able to engage. And then also just asking colleagues for tips and tricks. We all have so many things where our colleagues are a plethora of information,
Agreed.
And it doesn't have to be other physicians. It can be the nurse. The nurse is so engaging with kids and patients, they are also a great secret to all of the engagement, because they can tell you things that you need to know about. They had a really bad day, or hey, that grandma of that family just died, and so you need to know about that. And those, just using all of the things around you is so helpful.
Yeah, that makes perfect sense. And I've subtly asked you multiple times, so I'm just going to come out flat right and say it. So speaking of self-reflection, tell us about your Bollywood dancing superpower.
So I was a competitive dancer in college. I did Bhangra and I did Bollywood and Garba, so lots of forms of dancing. And so, I've always loved to dance. And so when I came to KP, actually my chief found out that I did this. And so at our holiday party, asked me to lead a Bollywood dance. And so I engaged everybody at the holiday party, and we were all dancing Bhangra. That was like my second year here. And after that, I grew into, we used to do workouts at lunchtime at my medical office building. And I started doing Thursday Bollywood breakout sessions, and Dr. Harini Reddy, who helped spearhead the Women in Medicine Symposium, found out about it. And so she asked me to do the Bollywood breakout session. So now at Women in Medicine Symposium, I will do a Bollywood breakout session every year. So it's something that really brings me joy. And honestly, it was one of those moments where all of my worlds kind of collided. And it's a really cool thing that I get to share, that I got to be my identity as a physician, as an Indian person, and my love, and as a dancer, all got to kind of collide. And it's such a fun thing for me to do.
That's phenomenal. And by the way, shout out for the KP Women in Medicine Conference. It's not just for women. I go every year with my wife, who's also a physician, and it's been a great tool for me to learn how I can be a better ally for my female colleagues, both physicians and NPs and nurses and you name it. So shout out to the Women in Medicine Conference happening in this June, I think.
I believe it's going to be June. Usually it's during the summer months.
Yeah, it's usually at a really nice hotel also. So, all right. Well, this is phenomenal. We could go on and on, but we want to keep these short and high yield. Last, and perhaps my most important question: what makes you most proud to be a Permanente physician?
Oh, do you have like another 2 hours?
No, you got 2 minutes. Go.
Short and sweet. No, it's that I get to be a physician and practice ethical medicine, and also that I get to pursue other avenues of my strengths. So I don't have to just be a physician. I get to do all of these other things too in my director role. So I am just thrilled to be a part of this organization.
Amazing, amazing. Thank you so much for joining us, Dr. Soni, and sharing your expertise and your thoughts with us today. We really appreciate it.
Thank you for this opportunity. I appreciate it.